Dr. Jonas Apostol.
Sa kapunta to the moon, road trip, brum brum, skr skr, zoom zoom, sa fake, no room.
I'm sure most of you guys are familiar with that song, To the Moon. It's a Nick Makino's hit, but I am not going to feature Nick Makino's case. This is Nick Makino's this is Nick Makino's partner, Siobe. So I have completed this case like last year, and medyo late lang yung pag-upload namin because we took lots of pictures also, and part of which is healing. Okay, it's very, very important. So let's talk about the case proper. So Siobe, or Crystal, she's actually a kind of celebrity. So lumalabas siya sa mga music videos. She's also an influencer and model, and it requires beautiful teeth. So her main concern actually is like the missing tooth na medyo she's not really that confident. Of course, it's a business wherein she requires to smile a lot and talk a lot, and that's what we're going to do something about it, like put something in there for the missing. But it's beyond that. We are talking about the health also of the teeth. There are demineralized area, caries of the teeth, caries, and uneven color of the teeth whenever she smiles. So these things are a few factors that we need to do something about the case. So she's young, she has a beautiful smile, but we can actually enhance it, not just the smile, not just the aesthetic, but of course, we need to improve the health of the teeth in general. So we also need to help the patient improve the functionality. That's why we are going to create a smile transformation with dentofacial approach. So it means it should be healthy, it should be functional, and most of all, it should be beautiful. So one of her concerns about her teeth is that, according to her, it's kind of small yung ngipin niya. Nalilitan siya, ganun. So she doesn't like the appearance of her teeth, except for the pangil. She wants to keep the length of the canine. So these things, ano naman to, it can be modified to her liking, no? And also the color, we can do something about it. I'm really happy that she entrusted to me the decision in creating the design for her. That's what's best for her. Because in dental reconstruction or smile transformation, there are a lot of variables involved. So sometimes, whenever we choose the design, or whenever the patient chooses the type of design for her, sometimes it's not gonna work because there are a lot of variables. Like, we have to consider the functionality, we have to consider the color of the teeth, we have to consider the gums, we have to consider a lot of factors, we have to consider the health. And hindi ibig sabihin that we give the patient the right to, ask for what's best for them. It doesn't guarantee that it's 100% na mabibigay talaga sa kanila yung the same exact color, the same exact design, because ang daming ang variables when it comes to dentistry. And I'm just happy that Crystal gave the full trust in creating the new smile. So in creating smile transformation, dentofacial analysis is very important. This is a mathematical calculation in order for us to create a more predictable design for the patient. So we are actually measuring the height of the mid-face and the height of the lower face, and also the position of the central incisor when lips at rest, and the position of the central incisors when the patient smiles in a parang high E smile. No? So that's what we're getting in order for us to analyze also the teeth mobility. To check if gummy ba siya, low lip line, the extension of the buccal corridor. We are also looking at the behavior of the lips when patients talk, and we also check a lot of things. So dentofacial aesthetics is not just about looking at the teeth, but also looking at the whole feature. That's why we are also taking notes of the facial types, and that's very important. The arch types, a lot of things. So with her case, we can see here, it's not that bad, but we can improve it. And when we do our analysis, it's not just about clinical. We are also looking at the radiographical thing, because we consider a lot of factors when it comes to the health, the bone, the root of the tooth, if there's any infection, if there's any problem. So we are incorporating a lot of things before we can come up with a proper design for the patient. So dapat a holistic approach, no? So as you can see here, cavities, we have small problems like demineralization. We have problems with the protrusion of two teeth or alignment. It's not as symmetrical, but it's still acceptable when it comes to aesthetics, but we can always improve and enhance. So there's a lot of room for improvements and possibilities when it comes to a total reconstruction, because it's always holistic. One of the factors when doing the smile design is also the personality of the patient. So medyo she's into music industry, vlogging, modeling. So mas gusto niya na syempre at least a little bit more mature smile that would really complement her personality. So that's what we did with her case. So the treatment plan for her case was 8-unit ceramics from first premolar to first premolar on the upper arch, and plus the implant, of course, to correct or replace the missing tooth. So the selection of material is always depends on the case, no? So we can actually use a high fusing porcelain with a zirconium oxide core, but with her case, because we wanted to have like medyo supernatural effect, see-through effect, so we chose a lithium disilicate instead. So I did a type 1 classification of veneer preparation. So there are a lot of types of veneer preparation when it comes to dentistry. It's not just one single design. When it comes to veneer designs, there's no like single template. There are various types. According to Pascal Magny's book, we have 3 classifications, 3 types that we have to consider. So first is we have to check the color, if that's the problem, if there's a morphological changes, or there's an extensive caries. So it's always case to case. But with her case, we did the type 1, and some teeth we did type 2. So it really depends. There's no single approach. It's always case to case. So the usual waiting time after the preparation is 1 to 2 weeks, no? Usually 10 to 14 working days. But because of their busy schedule, like concerts, gigs, dami nilang pinuntahan, they went to Cebu, they went to other places. So it took them like 3 weeks or more to went back for the final installation of the veneers. So when they came back, we did the try-in, of course, to check the height, the design, kung bagay na. So she approved of the design. That's why we cemented same day. And as you can see here, so the shade, it looks perfect on her face. And also, as you can see, it's almost the same color as the eye. The shade is B1, high translucent. So I mentioned earlier about the implant, so it will take 6 months for osseointegration. Currently, she's just wearing a temporary for that implant just to complete the smile, and also it forms the gums. So when we do our smile transformation, it's not like super magical kaagad na it will adapt perfectly the same day. Okay, there are cases like that if you have really bad teeth, but most of the time it requires time for the mouth to adapt with the new sets of teeth. Imagine, it will take years for our teeth to be formed completely. Matagal yan, process yan para makomplete. Pero when we do our smile transformation, it will take 2 weeks, 3 weeks to be completed. It requires time talaga bago masasabing it's like your own na parang it's well adapted. It will take time. Usually it requires 3 months to 6 months. But the best thing about this type of treatment is that the material is very durable. The material is stain resistant, and the material will adapt naturally to the teeth, and it will as if act like your normal teeth. So don't judge quickly based on what you see right away. Allow time to adapt. So usually kasi after the placement of the final, we're not confident about the result sometimes. Parang, oy, there's off, like I cannot close my lips. Yung the last time nung hindi pa ginagalaw, yung parang medyo hindi ako makangiti ng ganito, ng ganyan. Sometimes ganon kasi talaga at first. That's the reason why there's a smile design. That's the reason why there's a dentofacial aesthetics. That's the reason why we are doing our mathematical evaluation of your case. It's just for us to give you that more predictable. But at the end of the day, it will take time for you to adapt. Kasi it's biology. It's life we're talking about. There are a lot of things involved. We have the muscles nga, we have the nerves and everything. So, if you want to undergo any smile transformation, be willing to be patient, to adapt with the material. Kasi hindi siya like super perfect agad in just one go. Ganun talaga. It's always case to case. So if you want to see the new smile of Crystal, you have to visit her Instagram post, mga vlogs nila. You can see that it blends well with her face. So, ganun talaga. It requires time. So, thank you for watching. See you again on my next vlog.